Senator Ingram. I had a good view of your iPhone.
There you go. Well, it's better than a view of me for sure.
I did not say that.
Yes, sir. I was trying to see what I was reading, the summary that was sent out. Larry, do you know there's a request for Regional 1 in Memphis for similar funding for this? It is not on the agenda. Do you know the status of it?
You said Memphis. Paul, do you know?
Regional 1 that serves Eastern Arkansas, Le Bonheur and Regional 1 both have similar requests.
We have played phone tag with Richard Bearden for the last 3 or 4 days, and we need to get back with him. We've got to get some kind of an idea of the amount of contacts or the amount of people from Eastern Arkansas that are being served. Some kind of documentation to show that.
Okay.
You see where I'm going?
Yeah, I don't think it'll be hard. Yeah, as you know, that's who, that's City of Regional 1 Med and Le Bonheur see all of, well, from probably Brinkley east, they see all our East Arkansas patients.
Okay. I'll do my best to get a hold of them this afternoon.
Okay.
HA. Well, I thought I saw HA there, but I know there's no guys. Where's HA? There's HA. So I'm checking the roll right now to see where we are because it is 2 o'clock. You've got a quorum. Chill that. Steve Guthrie. Keith, okay, I'll get it. Mr. McVeigh tells me that we have a quorum, so I would like to call to order the Arkansas American Rescue Plan 2021 Steering Committee. Today is Monday, January the 10th, 2022. It's our first meeting this year. Apologize for the late notice, but we had an emergency situation that has arisen because of the current situation with regard to the Omicron virus and the amount of bed space that is being required throughout the state. So what I'd like to do is turn the meeting over to Secretary Jose Romero to explain his request, and then we'll discuss that and then take a vote on it. So Secretary Romero, you have the floor.
Thank you, Chairman and Secretary Walther, and members of the committee. So we come to you again today requesting allocation for funding. We're sorry that this is the first meeting of the year and it's rushed. So we're asking for allocation of $50,120,160 to increase bed capacity for Arkansas in response to the recent Omicron surge here in the state. This funding is for 11 hospitals, including the Children's Hospital here. It provides funding for a total of 265 beds. The cost is mentioned to you, and it is for a timeline of 30 to 45 days, depending on the hospital. It includes funding for both ICU and med-surg beds. I will stop here and entertain any questions. I do want to point out one slight typo in our presentation. So there's a cover sheet that describes the request per hospital per bed for beds, and it states that the hospitals will use existing staff. That is an error. There is no existing staff to pay at this time. So this funding would be used to provide funding for outside staff. Thank you.
Thank you, Secretary Romero. Do we have any questions concerning this request?
I have a question, Mr. Chairman.
Please go ahead, Senator.
Dr. Romero, the money that we committed last, I guess that was last fall, was in excess of, I think it was to run the beds for 90 days. I can't remember the total amount of funds, 28. Well, I can't remember total, but the money that we committed, was that all used or was it, was there any that went unused that is being used now?
So Senator, thank you for that question. It was used, and I know my chief of staff is on the call, but my understanding is that that money is has all been used at this time. And if she has a correction of me, please go ahead, chief of staff.
Yes, sir. This is Renee Mallory. The majority of the funding was used, Senator Ingram. Now we need to say we have sent at least 4 of those. We've put the packets together to send to FEMA. The second one was sent, I think the 5th one last week. If you remember, we had 5 hospitals. And they are telling us that those packets look good for us to be reimbursed all of that money from FEMA that we used of ARPA funding. And it was like $66 million.
Okay. Yeah. Okay. Thank you so much, Renee. Thank you, Dr. Romero.
Thank you, Senator.
So that sounds like there's a possibility of the money that we're allocating here could also be returned to the state through FEMA at some later date. Is that correct, Secretary?
I believe that is correct. At this point, we've not heard that it's not eligible for reimbursement. And I do have to reinforce what Chief of Staff said, is that we think we're going to get all 5 of these approved, and the first 4 were highly rated for approval.
Thank you. And as I recall, the money in the American Rescue Plan has a much longer time period over which we can spend that money. So that will bode well for future expenditure requirements of the state if we can get reimbursed from FEMA. Are there any other questions?
Secretary Walther, this is AJ, and I think this is correct, just looking at the list, but all of the hospitals are nonprofit. Is that correct, Dr. Romero?
That is correct. We specifically asked for not-for-profit hospitals.
Okay, and the period of performance for reimbursement is still open for this event. So I agree, we shouldn't have any problem getting reimbursement through public assistance back from FEMA on these.
Thank you, Director.
Okay, we're still open for questions.
I got one, Representative Jeff Wordlaw.
Okay, good. Please
So,
ask your question.
in talking to council leadership and us being able to sign this out as an emergency appropriation, which means we would take care of this as soon as you guys send it over, Chairman Rice had a pretty good question. He wanted to know, what are we seeing in the hospital admissions right now? Is it mostly COVID unvaccinated folks? Is it extreme COVID cases? When his concern was the news had been telling over and over that those cases were not extreme and not needing ICU.
Yeah,
So
no, those are excellent questions.
There's one more.
Oh, forgive me, sir.
And then the last question is what are we seeing in our adolescents, everybody under 18? And I contacted UAMS and Matt Gilmore earlier, but Matt was unavailable to talk. But UAMS is supposed to be compiling the data for children's and themselves on those same questions. So that's what he wanted to know. And in order for him to sign it out, he wanted to have those questions answered.
Yes, sir. We can provide that information for you. I can do that now. So we are seeing admissions to our hospitals. They are increasing. Some of those are incidental admissions. We know that for a fact. We know that that's the same. Yes, sir. We know that for a fact. We know that forgive me, an inside joke maybe, that they are increasing, sir. But at the same time, we also know that our ICU admissions are going up. So clearly these are COVID cases that are going into the ICU. What is happening today is that the burden of infections in the state has really super accelerated and past what we've had in the past in past peaks. And although overall, you are correct, overall the infections tend to be milder, there are still a number of individuals that are going to have more severe disease and are going to be admitted. And because there's such a large volume of individuals that are positive, that small group of individuals will expand. So we're seeing our numbers.
Are those admissions mostly unvaccinated or vaccinated?
Yeah. Okay. So here, that's where I'm going now. So they are mostly unvaccinated and unboosted. So
Okay.
What we're learning is that we need to get the booster in addition to the primary series. Yes, sir. And then what are we seeing in adolescents and children? So we're also following that. And what we're seeing now is the increase in hospitalizations of these children and some increase in cases in the ICU. Our projections here at the health department are that we will exceed the number of ICU admissions at peak, which occurred during the Delta this month for this time, based on the number of ICU admissions we have at this moment. So we will see more cases coming in.
Okay. All right. I think that's good enough for me. And that's basically what I told the senator, but I wanted to make sure I was correct. So I wanted to be sure and put that question out there today, because obviously his signature will be very important this afternoon or tomorrow.
Yes, sir. We can provide you firm numbers on that if you wish.
Yes. And he and I have a call at 4. So if there's any way possible to get some numbers before 4 p.m. today, that would be awesome.
I will reach out to our state epidemiologist and get some numbers.
Thank you.
Dr. Romero, follow up on Representative Wardlaw. Did you say the peak? When do you anticipate the peak? Would it be this month?
Yes, sir. So what we're seeing is that the peak, at least in other countries, is the duration has been about a month. We're starting to see now that New York and some of these earlier states may be trending downward. It's about 3 to 4 weeks. So somewhere between 3 to 4 weeks. As I explained to the governor last week, I think we're going to start to see it go down towards the end of the month, all things being equal. Remember, though, that we do have the disadvantage of a significant number of our population not being fully vaccinated.
Yep. Thank you.
Are we, Chairman, I have another question, if
Please
allowed.
go ahead.
Are we pushing out, I know we advertised hard back during the summer to push people to get vaccinated. Are we pushing out hard on the booster and what the effects of the booster are to this new variant and how that is helpful?
Yes, sir. We are doing that. We're pushing even harder now. There's, if I can just parenthetically add to this, last week a report came out of the Morbidity and Mortality Weekly Report from the CDC, which shows that children that have been infected with COVID are now developing an increased incidence of diabetes. And so we're going to be pushing that out in public service messages, so to hopefully get the kids immunized. We know that adults also are at greater risk for diabetes if they have COVID.
Can you send something on that to the members and maybe to Bureau staff? Because it may help if the members start putting some of this stuff out on their social media as well, because we all knew going into this polio, we didn't know what polio was doing when it hit, and we found out that it had after effects. Obviously, COVID is going to be the same way. We didn't know what the after effects would be, and there are some, as you're saying, with diabetes and different things. So it would be helpful if we educate the public somehow in a heavy way to how important it is to prevent it from ever becoming your problem.
So I will have my staff send out the MMWR report. The important part of that report, so you don't get bogged down on all the statistics, is read the first paragraph and then read the summary. It tells you everything you need to know. And we're also going to have some more information tomorrow, which I hope the governor will allow me to share in a slide form during the press conference. We can get that to you as we have it prepared.
Okay.
Secretary Romero, you mentioned the percentage of the population in Arkansas that are vaccinated. Are we on the lower half of the states whenever we look at that statistic?
We are, sir. We are in the lower third, sir.
Lower third. Okay, so that means that we have a higher percentage of our population unvaccinated who are vulnerable to the COVID.
Yes, sir.
And they're vulnerable to all 3 strains of the COVID, the original one, the Delta, and now the Omicron, or whatever else is out there.
That's correct, sir.
And
That's
the ones we're seeing in the hospital, are they Omicron?
So the answer to that is that we're not typing all of those, but based on the epidemiology here in the state, they have to be Omicron. I mean, I would bet my mortgage on that.
And so whenever you get it and you're not vaccinated, the impact of that can be quite devastating is what I'm hearing. Just like maybe COVID, the other COVID, the original.
Yes, your risk of going into the hospital is greater than somebody who is fully vaccinated and boosted. We are really learning that the booster is important in this case.
All right, thank you. Are there any additional questions of Secretary Romero? Hearing none, I would entertain a motion for the approval of Secretary Romero's request for
So moved.
$50,120,160 to provide bed capacity in the proposed hospitals, and that list is contained in our handout.
So moved.
We have a motion. Do I have a second?
Second.
Okay. All those in favor say aye.
Aye.
Any opposed? Hearing none. Motion.
Romero abstains, sir, because of conflict.
Beg your pardon?
Romero abstains at this point.
Okay.
I
right.
recuse myself, sir, from the vote.
I don't know why, but if you want to recuse yourself, we'll accept that. Is there any additional business to come before this committee today?
I do have something to bring up, Mr. Chairman.
Okay. Please.
Last week in Public Health Committee, the committee heard concerns from hospitals around the state and concerns from nurses around the state with the increased pay through travel nurses compared to the nurses that live in those towns and work for basically a third of the pay. One thing there's been a group of us in the legislature pushing for is some way to have some type of fast track nursing program to where we can get nurses out of college at a faster rate and off of these waiting lists that we have around the state at our schools. One thing we've heard from all the schools is that we need to raise the pay for those type of professors because they can make more money being a nurse. And yeah, they,
There's a nurse. Was that a nurse right there?
Can't get away with anything.
Representative Wardlaw, I think you just turned red.
Yeah, she just messed that all up. Anyway, she's going to get the kids from school. There will be a request in the near future, and I'm not sure if that request is going to end up coming from DHS or from higher ed, but we are going to need to put full force behind this request to help get more nurses in the field. So I'm just kind of giving everybody a heads up and that it's coming, but this will be a fairly large request, I'm sure of, but it's coming at some point. Our healthcare industry is concerned.
Hold on. What? No. Look at, was Gossage riding that horse?
Was that Gossage?
Yeah.
That was Gossage. So just kind of a heads up, Mr. Chairman.
Representative Wardlaw, what would be the nature of the request, if I may ask?
Right now, it looks like some type of one-time pay increase for professors because they think the enrollment will support that pay increase going forward once they can open that enrollment up. They have U of A and Fayetteville has about 700 people on a waiting list. I don't want to be held to that number, but it's a high number. UCA has a waiting list as well. We're hearing other institutions have waiting lists. Those are the two I know of. So once they can open that enrollment up, they think the revenue will support itself, but they're going to need help to get it opened at the beginning.
Okay. So it's you're getting instructors and professors into the system to train the nurses.
That's correct.
Okay. All right. Thank you.
Thank you.
Okay. Any additional business to come before the committee? Seeing none, we stand adjourned. Thank you.
Thank you all for your votes.
Thank you.